Next up is Congresswoman Betty McCollum from Minnesota.
Thank you, Madam Chair. I do want to thank the witnesses today, and I want to thank people from all over this country who are sharing very personal stories of what's happening with their bodies and what's happening with their families' incomes. Thousands of my constituents have reached out to oppose Republicans slashing trillions of dollars from Medicaid. In my district, 19,000 people are expected to lose their Medicaid coverage. Hundreds more have sent me messages concerning the end of the Affordable Care Act credits, like Allison in St. Paul, and I quote from her, "If this credit expires, my effective health care costs would increase substantially, putting additional strain on my household budget at a time when my family, like many others, are already struggling with costs." I held a roundtable where some small business owners shared their stories about health care coverage for families and their staff. Dan, who's been selling toys in St. Paul for more than 27 years, co-owns Mischief Toys with his wife and daughter. They're already facing tough increased costs due to Trump's tariffs, and now they're staring at a 20% hike in health insurance costs. And yes, I did say 20%. This increase would have been higher had it not been for Governor Walz, the DFL working with Republicans to establish a reinsurance program in Minnesota. Dan and his family are gravely concerned about how their family's business is going to survive and just how they're going to survive with pre-existing conditions. So my question is for Jackie, and excuse me for being so informal. You shared so much, Ms. Holcomb and Ms. Frizz, if there's time. How will the cancellation of the ACA credit impact, and you've already kind of said how it'll impact you, but so many of the other people that you've networked with, either you started sharing with families, with children with disabilities, you as a businesswoman, you're going to have to make compromises. So what kind of compromises are you hearing others make in conversations? One compromise I know that my constituents were telling me, if they're lucky, they'll pay more for less coverage, if they're lucky. Would you both just kind of elaborate in a minute a little more?
Okay. So I'm back to the drawing board. I have to do my research. And again, I can't plan my budget without knowing what my premium is. Is it doubling? Is it tripling? Is it going from what it is now to, who knows, $3,000? So I'll have to shop around. And, you know, my husband has his own business. I work with him, you know, at almost 60 years old. You know, can I go out and seek employment and get insurance through an employer? Is everybody going to be doing that because they're losing their coverage? I can't plan for my future when I don't have the truth and the facts of what is going to happen. So I'm trying to answer your question. You are. But I can't because I don't know. I think I speak for a lot of people that have a story similar to my family's.
That's right. You don't know.
I have no idea.
I think that when I think about compromises and what kinds of things our family and others like us would have to compromise if the cuts to Medicaid aren't rolled back, I think about that the promise that we've always made to our kids since they were born is we're with you till the end of the line. And when they were little, their doctors made a commitment that they didn't just want them to survive, they wanted them to thrive. Mm-hmm. And we've always tried to live by that in our family. And so when I think about the Medicaid cuts, for one thing, we've pretty much kind of set aside the notion that we'll ever be able to retire if the Medicaid cuts stand. We just imagine that we'll have to continue working as long as we can in order to pay for as much as we can for especially our kiddo who lives in a group home and has some pretty significant special needs. So that's not, saying, well, we think about not retiring. I mean, that's not like a lot of people that, like Ms. Broth was talking about, where they're not going to get their insulin tomorrow. So I recognize that. But I guess what I would say is I don't understand why I'm having to make this compromise in order to give money to billionaires.